Hello, everyone. My name is Francisca Blanc. I am with Utah Housing Coalition. Today, we are doing the second webinar in our series on federal financial assistance for Utahns. And this Wednesday, on August 4th, we will focus on healthcare. Utah Housing Coalition and the Association for Utah Community Health and Utah Health Policy Project are part of the Family Investment Coalition, which is a statewide coalition made of advocacy and educational nonprofit organizations in our state. I would like to welcome Rachel Craig and Melanie Innes with Association for Utah Community Health, also known as OUCH, and also Teresa Sanchez and Sarah Letham with Utah Health Policy Project. My colleague, Olga Hernandez Favela, she is also with Utah Housing Coalition. If you have any questions for the people in attendance, you can post them in the Q&A and the speakers will able to answer them. After the webinar would be live stream on YouTube, we're gonna sit on our channel as a live video, and then we're gonna be added to the playlist on this particular subject, federal financial programs for Utahns during COVID. Rachel, you are welcome to start your presentation.
Perfect, thank you, and welcome everyone. Like Francisca said, my name is Rachel Craig. I'm the Legislative Coordinator at the Association for Utah Community Health. I am just going to share my screen right now. And we can get started. So basically what we're going to go over today is just some of the financial assistance that's available for paying health insurance plans right now. There is quite a bit. It's been extended, or not extended, but expanded upon through a couple of the COVID-19 packages. And we just want to make sure that everyone's aware of all of this. So what is the special enrollment period if you don't know? A special enrollment period is basically a time where you're allowed to basically sign up for a healthcare plan through the federal marketplace, also known as healthcare.gov, also known as the Affordable Care Act plans. And right now, there is a special enrollment period that is running until August 15th. So the end of that is coming up pretty soon. Another reason why we're doing this. It basically means that you're allowed to enroll in a plan without any major life change. That's usually the only time that you are allowed to outside of open enrollment. If you wanted to enroll in a marketplace plan, you did have to have some type of major life change, like birth of a child, a move, a marriage. But right now, you don't need to do any of that. And this special enrollment period was created specifically to assist those who lost insurance coverage during the COVID-19 pandemic due to a change in employment or loss of employment, and then also cover those that were uninsured prior to COVID-19. So if they were to get sick, that they would have this type of coverage, especially considering all the financial barriers and other health challenges that we've seen beyond just COVID-19 itself. Since the beginning of this pandemic. So there's a lot of, I guess, subsidies right now available to most, I would say like the grand majority of Americans, if they are enrolling in a marketplace plan right now. They are paid out in the form of advanced premium tax credits, or APTCs, and premium caps. One of the most major ones is APTCs available to consumers with a household income above 138% federal poverty level. And it also caps how much a family's household income can be paid towards premiums for a benchmark plan. So consumers with household incomes between 100 to 150% FPL might be eligible for coverage options with zero premiums, although we will mention, and we'll talk about this a little bit more later, that Utahns with household incomes of 138% FPL or below qualify for state Medicaid, which in most cases is the best route to go. 4 out of 5 enrollees are going to be able to find a plan for $10 or less after these APTCs. And after August 15th of this year, consumers that experience a life change and then would qualify for a new enrollment or a change in a plan also will have these APTCs available to them. So even though the open enrollment period or the special enrollment period that's open to everyone ends on the 15th, if you do have a client or you know of someone that did have a major life change and lost insurance or moved or anything like that, they can still claim this subsidy, which is a pretty big deal. So how is this different from before? This APTC and was only available to consumers with a household income below 400% FPL. So now there is no basically kind of cutoff for someone to be able to enroll and get this subsidy. And there was no cap on premium payments either. These payments are going to be retroactive for the months prior to a plan change, or they will not be retroactive for the months prior to a plan change, but they might be able to, the consumers might still be able to get these, I guess, subsidies when they file their federal income tax return. So it's not like you're going to get like a lump sum payment of all the months that you missed, but when you file your taxes, you might see it in the form of a tax return. And these APTCs and caps on premium are going to be available for 2021 and 2022 plan years. There is talk right now about expanding that and making these permanent, but right now there's nothing set in stone. So just making sure that consumers are aware that this will not apply as of right now to 2023 plans. There's also a major expansion of APTCs for the unemployed or people that were unemployed during 2021. So basically any household who had at least one taxpayer within their household receive or be approved for any type of unemployment compensation in 2021, regardless of their actual household income, these are also available to them. So basically what that means, any week that started in the year 2021, which I know is kind of a weird way to put it, but that is the wording. So any week that started in the year 2021 that a consumer received any type of unemployment compensation, that's traditional unemployment, pandemic unemployment, any of those programs, they will basically be treated like they have a household income of below 138% FPL and will then be available for some pretty serious APTCs. They have to have, they could, qualifying households in this situation would likely be eligible for free silver level marketplace plan. It would also apply to plans lower than silver level, but at this point, you probably want to direct consumers to pick a silver level plan because they're not going to get any money back, I guess, if they choose anything lower than that. This is going to apply to both new and existing enrollees. So if someone's already enrolled in a marketplace plan and did claim any type of unemployment compensation during the year 2021 or during a week that started in the year 2021, they can go in and report that they can go in and resubmit their application, report that they did apply and be approved for unemployment compensation during that time period, and they will be able to receive that APTC.
Hey, Rachel. I'm so sorry to interrupt. Could you possibly zoom out a little bit on the screen? I think the edges are cut off.
Oh, yeah. I actually don't know how to do that. So I'm going to stop sharing my screen and then share it on a different one because I think this is weird. I don't know why it's doing that. So 1 second.
No worries.
I'm going to do it this way. I'm going to swap. This should work. Is that better?
That's perfect.
Perfect. Sorry about that. I'm not sure how that exactly happened.
No, you're totally fine. Thank you.
And we can share this information too with anyone that needs it. I'll drop my email in the chat. I'm happy to send this presentation and any other materials to anyone that needs it. So my apologies for that beginning part. That's a new problem that I didn't know existed. So
I have
Um,
new Zoom problems come up all the time, and I've been doing this for a while, so it's
I know,
totally
right? You think I'd be-
understandable.
Perfect. So if an existing enrollee doesn't actually resubmit their application to report that they were available or that they were eligible for these new subsidies due to claiming unemployment compensation in 2021, they can still receive this amount when they file their annual federal income tax return. But the best way to do it is actually go in and make that change now rather than waiting to file for 2021 taxes. This subsidy is only available for 2021, and I don't think there's any talks to expand it out to 2022. So any consumers that participate in this or receive this subsidy and then also re-enroll into 2022 coverage, they might not get the same amount of assistance. And that's something just to let them know that this might be just a 1 year kind of subsidy for them. And then again, just like the APTCs that I talked about before, if someone does experience a life change after August 15th, they are still eligible for this subsidy as well. Melanie, did you want to add anything about either of these two?
No, I think you pretty much covered it.
Perfect. So I'm going to pass it off to Melanie right now to talk about the health insurance premium support system or our support program or the HIPS program.
Wonderful, thanks. Rachel, do you mind popping over to the HIPS slide on the presentation?
Is it not on there? Because it's showing for me that we're on HIPS.
Oh, no, it wasn't updating as you go.
Is it now?
It's still just on the front page of the presentation, the intro slide.
What is going on here? Teresa, would you mind trying to do the presentation on your end? Because it's showing me that I'm on, like I can see it moving through on my Zoom page, so I'm not sure what's going on my end. Or maybe not. Let me try and, I'm sorry about this, everyone.
You're totally fine. And if it's helpful, I don't know if you want me to try to share.
Yeah, if you don't mind, because I'm not sure what's going on with my computer because it's showing on my end that it's changing. So I don't really know.
Perfect. Do you mind popping a link to that in the chat, or I can send you my email? Whichever.
You're muted, Rachel.
Yeah, just 1 second. So I'm gonna pop it in the chat and then hopefully everyone will be able to see this now. Oh, I just sent that to just Sarah. So that should be going to everyone now. I'm very sorry about that. Can folks see that inside the chat?
Yes, let me attempt to share it. 1 second. Okay, can everyone see that?
Yes.
Okay, perfect. And then let me know what number of slide we were on.
One more back, I believe there, Olga.
Was it 6?
Number 7.
Gotcha.
Great. So just to talk a little bit about the HIPS program, Ouch administers a program called the Health Insurance Premium Support Program. It's a financial assistance program for eligible Utah individuals that assists them in financial assistance in paying their premiums through marketplace plans. These are for eligible Utah individuals earning between 134% and 250% of the federal poverty level. They must roll in a silver level plan to be eligible. Anybody is eligible for the HIPS program during SEP or open enrollment. After August 15th, however, individuals qualifying for a special enrollment period through a qualifying life change or something like that is still eligible for the HIPS program and can enroll through the end of the year. Most individuals qualifying for the HIPS program pay as little as $10 a month with these new savings available through these new marketplace plans. Anybody who can qualify for HIPS program can complete an application through healthcare.gov and then work with a qualified HIPS partnership. So either an enrollment assister at a community health center or another qualified community partner that Ouch works with to complete an application. And I'll be submitting a kind of a reference guide to HIPS in the chat. And if you have any questions, I'll be sending my email as well and you can talk to me about it. And just to finish this off, so any new or current enrollees can visit healthcare.gov to either fill out a new application or update an existing application, either with their new income or to receive those new advanced premium tax credits. After submitting a new or changing an application, you have 30 days to select or change a new plan. And all enrollment assistance is available to consumers. You can find this on healthcare.gov or through Take Your Utah or the Association for Utah Community Health. Rachel, you want to take it?
Yep, and just to wrap this up, in terms of what Ouch has on our end, enrollment assistance is available through community health centers. So you can use the link in the PowerPoint. It's now in there, but we can also send the link in the chat as well to find a community health center that does provide enrollment assistance. You can call them and they can help you actually apply for these plans and then find basically the best, I guess, financial assistance available to you, because as people have probably noticed so far, there is quite a bit of overlap in terms of like some people are available for multiple different subsidies. So they'll be able to find what is most cost effective and best for the consumer. And then just as an aside, community health centers provide high quality, affordable primary and preventative care to all Utahns, both uninsured, low income, and they provide their services on a sliding scale fee. And the care is culturally competent for the populations that they serve. So if you know of a client or a patient that is unable to afford primary care right now, community health centers are a great option to I guess keep up with primary care services. And it's not just medical primary care, there's also behavioral health, vision services at a lot of health centers and dental at a lot of health centers as well. And I'll drop the link for the enrollment assistance finder in the chat.
All right. Hi. Can you guys hear me all right? I'm using my little headphones. All right, great. So my name is Teresa Sanchez. I work with Take Care Utah, a project of Utah Health Policy Project. My colleague, Sarah Leatham, the Healthy Kids Program Director, is also on here with us. So we primarily help with TCU program assistance. And we enroll folks in Medicaid, the marketplace, CHIP, and all Medicaid programs, including CHIP. If you would please go to the next slide. So you might have heard of us before in the community. So we mostly are focused on helping people navigate the healthcare system by helping them apply and enroll. We also have a policy team that does advocacy and policy work. Next slide, please. So like I said before, we help with Medicaid and any program under Medicaid, including targeted adult Medicaid. We have a specific behavioral health program that we help, bridge those gaps for those communities that are at most need. We do Medicaid enrollment, marketplace enrollment, CHIP, which is the Children's Health one under Medicaid as well. And then we also do something coverage to care. So once someone enrolls in, Medicaid or Obamacare, we will help them with the process afterwards, getting their cards, setting them up with a provider, finding a primary care physician, setting up appointments, whatever they need, that it all falls under coverage to care. Next slide, please. So since March 2020, we have been doing remote work, but we are actually back in the office now. So you can still call our office and set up an appointment, either in person or virtually. And there's just our team and some information for you. Next slide. So you all talked about marketplace primarily, but I just want to touch a little bit on Medicaid, because we do help folks apply for Medicaid. And those who, we find that aren't eligible for Medicaid due to income eligibility, we end up, helping enroll into Marketplace. But for those, just a little brief overview of Medicaid, it's for, at least in Utah residents ages 19 to 64, must have some kind of legal citizenship or residency or visa. There are some federal poverty level guidelines. I think it's 138% right now, if I'm not mistaken. And then the enrollment is open all year, so there's not a specific open enrollment period that is open for everybody. Some of the programs, like I had mentioned before, are targeted adult Medicaid, the Spend Down program, CHIP, which is the Children's Health Insurance Program. There are dual eligible plans for folks who are also on Medicare. And then, there's other things that we can help you with as well with Medicaid. Next slide, please. So primarily when someone calls us and says, I'm looking for health insurance, we go through a series of questions to see what they would qualify for. And we usually use this income guideline, to see where they would fall. For example, for a family of 3, 2 adults, 1 child, they would still be eligible for Medicaid expansion, adult expansion, if they're making, $24,040 or less. And then, let's say that they're making 43. At that point, we would be looking into marketplace coverage, which is what Rachel had covered earlier, and then see what kind of what plans are available, what costs are available, and how many premium tax credits they will get once they do sign up. So this is just a brief overview of that. We could share that as well, or if you're showing the presentation, that's available too. Next slide, please. So with I don't want to cover too much or do too much overlap with Rachel, but those who are eligible for the ACA, must have specific kinds of visas, U.S. citizens or nationals, specific legal documentation to be lawfully present in the U.S. Unfortunately, DACA is not an accepted status. We do get a lot of those calls, and we have to refer them elsewhere. And then must meet income requirements. Like I said, we refer to that other eligibility guideline a lot to look at how much people are actually going to be able to qualify for. So really briefly, the special enrollment period that's open right now is going to end August 15th, like was mentioned before. But the open enrollment for next year, so your plan starts on January 1st, 2022, is from November 1st to December 15th. That's every year. But even then, there are still special enrollment periods available throughout the year. So throughout the rest of the year. So let's say that someone drops off of Medicaid or CHIP or loses employer sponsored insurance from here to December, you would qualify for a special enrollment period and you can still sign up for a plan for this year. Next slide, please. So what people who have been covered by the ACA, you hear just some statistics from our end that trends we saw since the expansion. 200,000 or more Americans enrolled in marketplace plans. Now more than ever, more folks are eligible and have enrolled in Medicaid expansion. With ACA or marketplace, you can have pre-existing conditions and you're still going to be protected under the marketplace, including 250,000 plus Utahns who survived COVID-19. So the marketplace really helps folks stay on healthcare coverage, throughout their years with, there's no discrimination or anything like that based on existing conditions. So it really has expanded the coverage for folks who were not able to get health coverage otherwise. Next slide, please. So in Utah this year so far, an average of 90% of Utahns enrolled in marketplace coverage, and they do receive premium subsidies. So because of the American Rescue Plan, those subsidies or those premium APTCs went up, and they reduced the cost of premiums. You could find now a plan that's, like Melanie had said, that's $10 or less. And thanks to the HIPS program, we have enrolled so many folks who are even eligible for zero cost plans that would normally be, $100 or $200 for a family of 2 or even a family of 4. That is a lot of savings for, for this year. And again, it is only for this year. We don't foresee that continuing next year. Next slide, please. So yeah, that being said, there's just a few more stats here. There's $0 premiums for a family of 4 that is, at the 150% FPL. This year, because the HIPS program was extended, and I don't want to talk too much about it because I don't know, all the details, but it was expanded even further up to, I think, 400%. And so we had a lot of families who were eligible for even more savings there. And that's the new premium assistance. There's also $0 premiums for Utahns who had been on unemployment this year. That was completely new for this American Rescue Plan. Next slide, please. And then some of the things that we saw in Utah specifically, 47% of new enrollees in Utah found plans that were less than $10 from April 1st through June 30th of this year. And then we saw that 1.5 million Americans sign up for new coverage between February and June 30th this year. And then 2.5 million consumers had come back to the marketplace since April and lowered the monthly premium after these new premium credits by 40% on average. So maybe there was folks who had decided not to enroll again because of cost. This significantly went back up. The enrollment went back up and people came back to marketplace. Next slide, please. So just really briefly, I also want to mention, we do get a lot of folks who are undocumented or have, aren't eligible to receive Medicaid or marketplace because of the income level, either too high or they're just, in those gaps where they aren't able to receive those coverage. We often refer to community health centers that offer sliding fee scales, such as Ouch, and then we also refer to Midtown clinics or 4th Street. There's folks who also go to like urgent care centers who, have this one emergency or one thing that they need to be paying for. We'll refer them there. We also refer to free clinics such as Hope Clinic and People's Health Clinic up in Park City, as well as Milwaukee. And we, most of these clinics are also places we partner with, and we try to do, enrollment there so that we can get access, to the clients who need help. We also refer folks to the University of Utah Health Wellness Bus. and we, try to refer folks to financial aid directly with the clinics or the hospitals and where they got their assistance or their healthcare. Next slide, please. So if you have any questions, feel free to, put something in the chat. You can reach us at takecareutah.org, Utah Health Policy Project, or our phone number, which I will drop in the chat as well, to schedule an in-person or virtual appointment with us. Thank you.
Awesome. And if anybody, I'll stop sharing the screen now. But if anybody does have any questions, please feel free to pop them in the chat, in the Q&A, whichever is easiest. While we're waiting for that, I did have a question for everybody, really. We have been working a lot. So for example, with the rental assistance program that's going out through the state, we've been working with community organizations that work specifically with BIPOC communities. I'm wondering if you can share anything about certain inequities or certain barriers that maybe clients have expressed to healthcare, or anything related. We're just I think I'm really curious to see if there's any overlap between the barriers in different sectors to folks. So I'm wondering if anybody can talk a little bit about that.
I mean, I would say right off the bat, it's really a lot of it's immigration status. I mean, community health centers obviously provide sliding fee services for uninsured folks. And we do know that there's a large portion of the uninsured population that is also undocumented. I would say that would be probably the biggest one and the biggest hurdle here in Utah. I don't know if anyone else would disagree with that, but I would say that's probably the hardest. I mean, there's just basically a barrier on most services for most undocumented individuals, or even people that have visas. There's just, it's like Teresa said, like a lot of people aren't eligible for marketplace plans, even though they're not necessarily like traditionally undocumented or anything like that. So I would say that's really the biggest one, and probably the most difficult hurdle to really overcome, because at least in terms of community health centers, the care that they provide, they make sure it's culturally competent. So the way that health centers really work is that through a lot of data, basically these health shortage areas are identified. They can be rural, they can be frontier, but they can also be urban based, because there's just a large population of low-income individuals living in a particular area. And because of that, and because they're serving populations of people that are pretty, I guess, similar ethnically and racially, they are able to provide that like culturally competent care. So I think, I mean, obviously everyone can always do better. We can always improve. Health centers can always improve, but I would say at least what we hear from the health centers, it's always about immigration status is by far the biggest barrier.
Yeah, I would like to kind of echo that as well. I mean, for sure it is about, we have a lot of folks who weren't eligible for any of those programs due to immigration status. And especially, continuing from the beginning of the pandemic, we definitely saw a big influx of people calling for different services. So housing, food, and security, like there is so many. So there was a huge overlap in all the services that they needed, and not being able to even have access to them. I would also say that, because of everything that happened, the Department of Workforce Services, and the Department of Health reacted, and, there was dropping coverage this year because of, things that had been put in place for COVID, but now are coming to an end. And so we see a lot of folks who are dropping off coverage and trying to hurry up and get back on. And then I would also say that, the language barriers still exist. I think that if people who have multiple jobs, or just, have a job and are taking care of the kids and everything, it's really hard for them to, do any of this process on their own. And so that's where our services, at Alchip, Take Care Utah is really critical in serving these communities.
And I will mention, like Teresa said, one of the biggest barriers about this is specifically related to Medicaid. Right now, basically no one has been removed from Medicaid or shouldn't have since the beginning of the pandemic. However, we're starting to see DWS start to send out letters that basically tell people that they need to go through the re-eligibility process. Even if someone is found ineligible, they will not be removed from their Medicaid plan until the end of the public health emergency, which we expect right now to extend through 2022. There is a chance now, I think, that it could be even longer than that. So this is kind of preparing for something that's going to happen in the future. CHIP cases were different. A lot of children lost CHIP coverage. And I don't think we have any hard data on this. You can correct me if I'm wrong, Teresa, but I'm pretty sure right now we don't have data to tell who actually lost coverage, but I would assume it was mostly BIPOC folks that lost coverage for CHIP, and then probably a lot of them that will lose coverage during Medicaid because they didn't finish the re-eligibility process. I would again assume that it would be BIPOC folks, and that's just because of just income divides, I think. And a lot of people have moved around. So if someone's sending a letter to a house that someone doesn't live in or an apartment that someone doesn't live in anymore, how do they know that they're going to lose coverage? How do they know that they need to go through that re-eligibility process? And I know there's a lot of stakeholders, Take Care Utah and UHPP, Ouch included, and then more than that too, that are going to be working to make sure that we keep as many people covered as possible. If they're eligible, we want them to keep their Medicaid coverage. But if someone doesn't finish the re-eligibility process once the public health emergency ends, they will be automatically removed, even if they are still eligible. So really trying to find those people, I think that's going to be a huge deal. And then those who are determined and eligible, letting them know that they do have options through the marketplace as well. So it's kind of like a two-pronged kind of thing. But I think that that's something to bring up if you know that your client is on Medicaid right now and they've moved since the beginning of the pandemic. I would encourage them to reach out to DWS and make sure that they have updated information and that they or help them reach out to DWS or reach out to DWS on their behalf to make sure that that information's up to date so they don't be removed even though they're still eligible. Because at least with the CHIP cases, I think the grand majority of the children that were moved from CHIP, it was, I think, well over 60 or 70% of children that were moved for CHIP. It wasn't because they were determined and eligible. It's because they didn't actually complete the redetermination process. So that's another thing. And that's a little bit farther on the horizon. But we just want people to be aware of it now.
No, that makes a lot of sense. Thank you, all of you, for sharing that information. And I think you're right on. There's definitely a lot of barriers, hurdles, and fears to accessing resources. But if folks are eligible, we do want to get them, just get them in if we can. I'm wondering if anybody. So I don't see any questions in the Q&A or in the chat. I'm wondering if anybody has any parting thoughts or messages. I really appreciated what you said, Rachel. Just get folks in if they're eligible, and try to do it that way. But I'm wondering if there's anything you feel the folks on the call should know moving forward and working with some of these deadlines that we have.
I think the big thing is that don't get too caught up on determining yourself what someone should or shouldn't be eligible for or will not be eligible for. Obviously, there's like a lot of people that do this all day that can do that for you. So if you even have an inkling that someone is going to be eligible for some of these subsidies or Medicaid or any kind of program, like in terms of like financial assistance or enrollment assistance for health insurance, make sure that you're just connecting them or help them connect with enrollment assisters, because that's really their job. They'll be able to tell you. So don't get too caught up. I think a lot of people get too caught up and say, oh, well, I'm not going to be eligible because I make too much money. I don't think that there's very many people right now that make too much money to actually get these subsidies right now.
I also wanted to add really quickly kind of going back to your first question as well, you know, we did have a lot of people who asked about public charge and having that be a huge issue for immigrant communities. You know, questions about whether they were eligible, whether they should apply because of their status, how it was going to affect them. Please just refer them to us and we can answer any questions that they have, because, you know, I mean, even now we're having a hard time kind of getting through that misinformation and trying to change people's minds about it, or getting them really informed about the issue. When in reality, public charge doesn't, Medicaid doesn't apply for public charge anymore. And it never really has in Utah, because if you don't have immigration status and you're not eligible to receive the benefits anyway. But their children, children mixed status families who have citizenship or just residency, those children are eligible. And I think that that's one of the major things that folks were not understanding, and why chip drop-offs happened, and, you know, or could have added to that. So, you know, and with marketplaces as well, I mean, you know, folks are probably not going to be able to afford it without the premium tax credits, but they can still get it for their children as well. If, you know, if they are citizens, they will still get a premium tax credit for them at least. So that's another one we want to remind folks, is to just refer them to the people that need, have questions about it, and not self-determine, I guess. How do you put it, Rachel?
No, thank you for sharing that. I want to thank everybody for being here today, panelists and audience members. And I think that's a wonderful point. There are some great community resources available, and folks who have the knowledge and have the resources to offer. So I encourage everybody to reach out, community build, if that's the right term, but definitely it's super helpful for clients to work across the board and work with each other. But I want to thank everybody for being here today. If you have any questions, feel free to reach out to the panelists. There's a bunch of contact information in the chat. We'll be sending out information as well, or reach out to us. But thank you so much, everybody, and I hope you have a good rest of your day.